How many of you have a smartphone in your pocket or a cell phone? So, and now that I've brought your attention to it, how many of you want to check your email or see if you got a text or Facebook or something like that? I think just by asking about that, we have split our attention between two things. And, I think our cell phones and smartphones are wonderful. I'm not going to harp on you today about smartphone usage, but today we've certainly split our attention. So we're talking about attention today. And not only in the case of ADD, but we'll also be talking about ways that we can improve our own attention, because it's so important. There's been 1.6 million car accidents in 2011 from people that were texting or using their smartphone while they were driving. And ironically, I read that stat while I was in my car, looking for facts for this talk. And when we think about attention and focus and concentration, when we think about ADD, it's why has it increased? It's increasing over time. And there's more cases being diagnosed now more than ever. So in 2003, there was about 7% of kids were diagnosed with ADHD. In 2007, there was about 9%, and in 2011, it's up to 11%. So why is there an increase in incidence of ADD? Now, is there an increase in incidence, or are we just diagnosing more, getting better at diagnosing ADD? And certainly we're being able to understand that girls get ADD as well as boys, and that's happened. We've certainly seen that. We just picked up more cases, so we have gotten a little better at diagnosis, but that doesn't explain the whole picture. In our society, there's other factors. We're going to be talking about those today. What are the other hidden causes of ADD or focus problems and attention problems? Is there anything else going on besides just getting better at diagnosing? Doctors are pretty good at diagnosing ADD now. They're not always good at figuring out what's going on, what's the cause of it. I think there's more than just simple genetic link. We know that 30% of, so strongly genetically linked, 30% of family members, so for example, if there's a sibling, 30% likely that another sibling is going to have ADD. If one of the parents has ADD, 30% likelihood that one of the children is going to have ADD. So there's the rule of 30%. If we think about how we used to live, so go back, I'm going to take you back 100,000 years ago, the caveman days, where we were hunting and gathering. I thought I wanted to be an anthropologist as an undergrad, so I'm always interested in evolution and that kind of thing. We were running around and gathering and hunting, and we know that our exercise and activity is linked to cognition. If we are exercising, if we're going out and killing that woolly mammoth, then you have to figure out what to do with it. It's very complicated to skin it, carve it up, and preserve it then. What do you do with this huge thing after you've killed it? There takes a lot of thought and planning, which is really an important part of the prefrontal cortex development. You think about the prefrontal cortex, it's the front part of our brains right behind our foreheads. And it's involved in planning ahead, thinking, problem solving. And so the point is that movement's linked to cognition and planning. So how does ADD fit into that scenario? Was there ADD back 100,000 years ago? I think there certainly were those who were more excitement-seeking, who liked the thrill of the hunt maybe, and this was maybe our folks who had ADD, concentration and focus problems. We bring this to present day, and some may say, well, my child doesn't have any problems focusing or concentrating. They can focus on video games for hours at a time. There's no problems there, right? Has anyone heard this or thought this? And that's because video games typically are life or death scenarios. These are very excitement, they're very stimulating, very interesting. Usually the player is it's a life or death scenario. And so this life or death thing really pumps up adrenaline, really gets stimulation going to the brain, increases dopamine, and they can focus and concentrate. Same for these hunter-gatherers a long time ago. My point is there's always been a genetic susceptibility there. But then over time, other things can affect attention and focus. So let's talk about some of those. Certainly genetics, brain trauma, which we're going to be talking about in a minute, prenatal toxic exposures, oxygen deprivation, and foods. Those are some of the things we're going to be talking about today. Let's go ahead and talk about food. So here's some kids who are eating lunch at school, and it looks like they're doing a pretty good job at eating some vegetables and things. But does food affect cognition? Does food affect focus? You guys have any thoughts on that? Do you ever eat lunch and then feel sleepy and tired in the afternoon, or have a certain kind of breakfast and not feel so focused and concentrated? There certainly is a link. I want to tell you about a study that was done in the Netherlands. And they took 100 kids who had ADD and oppositional defiant disorder, and they put them on the elimination diet, which was basically all they ate was vegetables, poultry, and meat, rice, vegetable oil, tea, and they did this for about 3 months. They had 75% improvement in ADD and 45% improvement in oppositional defiant disorder. And these are kids who will say no and fight against you. And they improved too, despite taking all their foods away. I thought that was pretty remarkable. So food certainly can affect cognition. If there's food allergies and inflammation in the gut, that leads to circulating inflammatory markers and problems with the brain too. There's something called the Feingold diet. Have you ever anyone heard of the Feingold diet? So the Feingold diet is talking about, the food additives basically, food additives causing problems with cognition. That dyes can cause significant issues with cognition and focus especially. Why is that? Well, they're synthetic and they're not recognized by the body. They tend to be, some of them are very stimulating to the nerve cells. They bind to nerve receptors and are stimulating, causing that hyperactivity. Yellow dye also increases the excretion of urinary excretion of zinc through the saliva and the urine. Why is that important? Well, if you would have heard Dr. Ernest talk last week, you would know that zinc is critical for focus, for concentration. And folks with ADD typically need more zinc already, so it makes them worse. So the Feingold diet is really a whole diet that's been around for over 20 years to basically treat kids with ADD. It's very effective. Sugar. So I was talking with one of our colleagues here in the clinic about sugar, and there's certainly some research that goes back and forth. Sugar doesn't affect kids with focus and cognition, but I think you ask any parent and they'll, after the birthday cake comes out, there's, if you took footage of kids before and after birthday cake at a party, there's a big difference. Would you guys agree with that, or am I off base there? Sugar definitely affects how the body it reacts. It's not a healthy thing. Let's go back here and talk about head injury a little bit. So does head injury affect cognition? So we're hitting on some of these different topics, and of course at any time you guys ask questions as we go. So can head injury affect cognition? There's a lot more information out there now, or a lot more interest about football players and traumatic brain injury. And we heard about that lawsuit against the NFL by ex-football players and professional football players. There is, and they're suing for damage done, while they were playing the sport. Chronic injury to the head has caused them symptoms like memory loss, irritability, and depression in some of these famous football players. So there's a big drive to say, okay, is there something happening to our kids playing football in high school? There's a lot of more interest and research being done. So this is a study. I typically try not to use slides with a lot of words on them, but this is one I thought would be helpful to know about. Journal of Neurotrauma in 2013, there was a study on high school athletes, and they played football. They did 3 groups, and they did imaging, and they also did neurological testing. In one group, the football players had a diagnosed concussion with neurological symptoms, and that was consistently seen on the scan too. They did a brain scan. The second group had no diagnosed concussion, but they had no symptoms, and their scan was basically normal. The third group had no neurological symptoms. They couldn't pick out that there was any problem going on, but on the scan, they showed that there had been a concussion, there had been damage to the brain. And testing bore this out, that there were cognitive deficits in these kids. So traumatic injury to the brain, even at a young age, was causing problems. These kids hadn't had like a significant concussion that they knew about, but they were hitting their head regularly. So we know that hitting the head can cause a problem. The brain is very soft as butter or jello, and the skull is hard. It's like a rock. And so injury to the brain does matter, and even these subtle injuries over time can make a difference. And I think that's part of the problem. I think some of the kids with ADD, it's more of a brain injury versus they may have some genetic susceptibility, but then brain injury could make it worse. Or maybe they didn't have susceptibility, but brain injury can certainly cause problems with attention, focus, memory, irritability. Candida and gut infections, just want to touch on that briefly. That's typically something that's found with testing. We do stool testing and gut testing in the office here that can look at types of infections in the gut, such as Candida, for example, which is a yeast overgrowth. And this yeast overgrowth, yeast, they're not so bad by themselves, but they, when they're very active and they're metabolizing the nutrients in the gut, they release all sorts of toxins, which are then circulated throughout the body. These are kind of like formaldehydes, and they can cause fogginess and thinking and problems with clarity of thought. So it's something else to look at and to rule out, especially if there are digestive problems or any other sorts of gut infections can cause the same types of issues. Any questions about foods and focus, ADD? Okay. Environmental toxicity. And some of this has to do with research being done on pregnant women, and there's a higher incidence of children with ADD and women who are exposed to things like PCBs, solvents, and pesticides. And we know that certainly there's also an increase in our environment and the amount of toxins. Our environment is much more toxic than it used to be. And so with that increased toxicity, some people are more able to metabolize out these toxins than other people. So for example, the analogy of the canary in the coal mine. Is everyone familiar with that? Basically, coal miners would take a canary down to the coal mines with them, and the canary is more susceptible to toxins as they're mining these, jewels or coal. Toxins sometimes are released. The canary dies, they get out of there quick because they're next. In our society now, the canaries in the coal mine are sometimes our children, sometimes adults that are not able to metabolize out toxins and chemicals as readily, and so they're not able to excrete them, so they keep circulating, and they get sick more easily. And that's, I think, why we see the increased incidence in part of ADD, but also autism, Asperger's, and neurological conditions, even increased rates of cancer and Parkinson's. But we're focused on ADD today, so it's certainly an increased incidence of ADD. So the canary in the coal mine. And how do you figure out this, if this is going on? There's a few different tests that can be done to figure out if someone, how they metabolize their toxin, if they've got a buildup. Sometimes you can do it through history and question asking. And that's part of what we do in our evaluation process is we spend 2 hours with you trying to figure out all the details of your life, and part of that is looking at environmental toxicity.
Do you use hair analysis as part of it?
Mm-hmm. So it depends on what the exposure has been, and if it's heavy metals, we'll sometimes use a hair analysis. Sometimes it's provoked urinalysis. So take a certain chelating agent and see how much metal is pulled out. That's one good way. Another test that I like is urine organic acid testing. And that's more looking at how the body's metabolizing out toxins, if they have any gut infections or any buildup of any problems. That's a urine test. But I like the hair analysis too, because it not only tells you if there's any toxins, but it tells if there's any deficiencies too. And it is just hair, so it's one piece, at least that's what's being excreted. But yeah, that's a good question. Other questions about toxicity?
After you do the test for the heavy metals,
Yeah.
And you get the results back, how is that treated? Is it treated through pills, or what happens?
Yeah, it's a good question. There's a couple different ways to treat it. When you find that there's toxicity in general, you have to increase all of the organs of elimination. That's the foundation. So increase hydration, increase excretion through the bowels, like using more fiber, and increase exercise. Sweating is one of the best ways to actually remove all toxins, including solvents, which are like inhalants, and heavy metals too. There's quite a bit of research on that. So that's the baseline. But then to specifically remove specific metals, like say it was lead or mercury, there's different chelating agents is what they're called, which are either pills or you can do IVs of these medicines that remove directly either lead or mercury. So like for mercury, it's DMSA typically, and EDTA for lead, for example. Those are just the different chemicals used. And then you do a series of treatments, typically, and then you retest to make sure that make sure you've reduced your burden of heavy metals.
Is there ever a time that doesn't happen? I mean, where it's not reduced?
Typically they are reduced, but it can take a while. So like the first time you retest, it may not be that much reduced, and then you need another 6 weeks, and then you retest again. If someone's burden is really heavy, it can take a year or more to reduce it, and it depends if you're doing IV versus oral. So there's a lot of factors, but typically, it's pretty specific. These chelators really reduce the burden. Yeah, they're very specific, and it's not just a naturopathic doctor talking to you. This is, if you went to environmental medicine at UW, they would use these same chelating agents.
Do you tend to start with the pills and then go to the intravenous, or is it kind of totally up to
It's based on preference, yeah. I mean, the IVs are much easier and they're very effective. It's once a week. It's pretty involved to the whole treatment.
Is it a 4 series?
For like IVs or rounds, typically do 6 rounds of treatment, six weeks, and then within that there's periods of rest and then going for it. during treatment.
Is that something you do here, or is it by your own doctor?
It depends on proximity. We do that here, absolutely, and we were doing IVs for a while. Those are on hold for now. Yeah, absolutely. And then if someone has a provider in their area, we'll coordinate care with them and get you going there. But yeah, a lot of the testing and treatment and diagnosing, we're very good at doing that, at assessing, okay, is heavy metals a problem? Is there something else that's more the issue? We don't just test everything just to test it. We're always looking for treating the cause, finding that and treating that specifically.
Are there specific books that you suggest people read about any of that?
Nothing comes to mind. Yeah, it's a good question. Yeah. Okay. Good discussion on environmental toxicity. I like it. Well, this leads into more about what we do, including the full assessments. We were talking about the history taking, question asking, and then we do brain imaging. So part of what we do and we're known for is taking a picture of the brain to figure out what's going on. And we can see areas of high activity and low activity, and then our goal is to balance it out and help in diagnosing and assessing what's going on. That involves an injection, some tiny needle, then taking a picture of the brain. You lie on a table for about 15 minutes, and we get a nice picture. It looks something like these two pictures here on the wall. And they give us information. And in full, it's about a 3-day process to do this. But I think everyone in here kind of is familiar with that. Any questions about that process?
Actually, I do have a question.
Mm-hmm.
So when you do that, when the person goes in there, do you just have them laying there quietly, or do you try to stimulate them in any way to
good
see any
question.
difference with the brain? Or?
Yeah, excellent. That's a great question. So typically on the first scan day, we do a specific concentration task called Connor CPT. And it's actually a test for ADD. And the person does this computerized task prior to getting the injection. They get the injection, then they do the scan. Second day, they're completely at rest. They're supposed to kind of meditate and relax. And the brain looks different at rest versus concentration. We can pick up different things. And actually can help in assessing for ADD specifically. Classic finding in ADD is to see a drop in prefrontal cortex function with concentration, which is kind of strange because you should get more flow, more activity when you concentrate. With ADD, you typically don't. And that's the classic version. It's like the harder you try, the worse it gets, kind of thing. And unless it's very stimulating and interesting, and then we see a rise of activity.
Mm-hmm.
So, yeah, we can see different things. We can see patterns of decreased temporal lobe activity, which is temporal lobes are right on the side, and that relates more to irritability, memory problems. And if that's combined with concentration focus problems, then it's more temporal lobe ADD, for example, because of the 7 different subtypes. We're not going to go into all of those today, but it's been helpful to differentiate as far as treatment, because not everyone's the same, and so it makes sense to treat in different ways to be effective. Because and that's who we tend to see is a lot of folks who've tried other things, it hasn't worked. You know, they've tried Ritalin, they've tried Adderall, and either have side effects or they're just not effective. So something we're able to do is assess, does the person actually have ADD, and then which type is it, and do they have any deficiencies, do they have any trauma to the brain, is there actually damage? And it's like we're trying to flog a dead horse, you know, it's like the brain will not activate no matter how much Ritalin you give it. It's like the circuits are decreased, and so it's like pumping more voltage through a weak circuit. So if we can increase and heal the injury, then the medications may work better. So, yeah, good question.
And that's a 3-day process?
3-day
You said
process,
for that?
yes. Mm-hmm. Yep. And so the first 2 days are history, taking information gathering. Third day is evaluation, meeting with the doctor and going over everything, putting the pieces together and coming up with a plan. And I'm a naturopathic doctor, I'll just say that. I'm a naturopathic physician with primary experience in mental health care. I worked in a residential treatment center prior to this for about 6 years, doing assessments and treatment on folks who have severe mental illness. So it was very interesting, good training. And then I came here to use brain imaging as a more advanced approach as far as the assessment goes. And so I use medications as well as natural supplements and treatments together. So it's an integrated treatment plan. Yeah. So let's talk about what are ways to treat ADD. What do we do now? We figured out what's going on. Let's treat it. Let's figure it out. Let's get it going. This is a scan of someone done before and after a 20-minute walk. You can just see there's red with increased blood flow and brain activity. This is someone, if you can see it, there's someone walking their dog and it's rainy Seattle. And she's kind of smiling, and you can see kind of like passing her, but she's smiling. You can see he might have, stepped in dog poop or something from one of her big dogs. She's laughing at him. That's what I saw when I looked at that picture. And I think it's encouraging. Like they're out there in the rain, they're exercising. That's what we have to do. It's like we're made to move no matter what. And we're talking about the cavemen. And it's really true. Exercise is one of the best treatments for ADD. It really works. It's like taking a little bit of Adderall, a little bit of Prozac, just in the right parts of the brain. It makes us feel good. It releases neurotransmitters. Not so much endorphins. We kind of talk about it releasing endorphins, but it's more so the neurotransmitters, serotonin, norepinephrine, and dopamine. We know norepinephrine is like adrenaline, helps us focus. Serotonin helps us feel good, relax. And so exercise is really one of the best treatments. When we get into it, it's really the more vigorous types of exercise that really stimulate the brain. So this is interval training, like 20 minutes, 3 times a week versus a long walk, which may be helpful for weight loss, and you'll release serotonin and feel better. But if you really want to stimulate the brain, it needs to be vigorous if that's a standalone treatment for ADD. We're going to talk about neurofeedback, and we talk about brain training. So we can do brain training. Actually, let's do this. Let's talk about this for a second. So here's brain training, and we have the My Brain Fit Life, which is brain training that you can do online. The brain training is using different types of games to actually increase certain parts of the brain, increase your focus, improve your memory. Using brain games, basically. And so here's Nicole Kidman, playing a brain game on her little device there. And it does work. Now, I was very interested to see if it would treat ADD also. So we all kind of are overstimulated and unfocused, but if it gets more severe, the brain games actually help. I think they help, but they don't actually treat ADD, at least at this point, at least the research. However, neurofeedback does. So January 2014, they did a study looking at this, comparing cognitive training to neurofeedback. And neurofeedback, back up here, was effective, especially after 6 months. So they've stopped neurofeedback, and it's actually improved their brains to the point that they can still focus and concentrate. And there's several studies comparing stimulants to neurofeedback, showing at 6 months, the folks who stopped taking stimulants, of course, they can't focus anymore, but folks who had done neurofeedback, it kind of rehabilitated their brains. Any comments? We have a neurofeedback therapist here, Margot Johnson.
Some of this research goes back quite a ways. And of course, as you were saying the last time I was here, it takes a while for that clinical application to become more mainstream. But 20 years ago we were talking about this, and Dr. Joe Lubar out of the University of Tennessee looking at that, and researchers in the United States and Canada, that that holds. It's not a treatment, but it's a training, and then when they learn it, they have it for the rest of their lives. So it's something to look into if you have ADD.
I don't feel everybody else
Go
probably
ahead.
knows this, but
No?
what is neurofeedback?
Oh.
I don't know.
Okay. Oh.
Yeah.
I'm glad you asked.
Yeah.
Oh, you know either.
Okay.
Thank you very much.
Biofeedback's been around for about 40 years. I've been doing it for nearly as long. It came out in the 70s. Biofeedback was this larger category of looking at using equipment to measure how the body's working and feeding that back to the individual. So not the nurse, not the doctor, not the technician, but the actual client or patient sees the information. If you can see or get information about what's going on in your body, you can learn to re-regulate that. So if you had a fast heartbeat, you could get the biofeedback and learn to slow your heart rate down. High blood pressure, bring your blood pressure down.
So it's basically you're connected
Mhm.
and there's like a screen in front of you, and so
Mhm.
you're seeing what
Yes.
you're,
Yeah,
okay,
Yeah,
and learning how to bring things
right,
down.
exactly, yeah.
Okay.
So the biofeedback might be the broad category, and then underneath that would be the different modalities that you can measure. For example, muscle tension or skin temperature or brain waves. So neurofeedback sounds like it's something different. It's just a type of biofeedback.
Oh, okay. Thank you.
How are the two connected, neurofeedback and biofeedback?
What's the difference between biofeedback?
Yeah, how,
Okay,
or
well,
how are
I
they
would think of
connected?
biofeedback as the large category, and underneath it are the different types of modalities that you can measure. So you could measure muscle tension, you could measure skin temperature, you could measure breathing or heart rate, and you can measure brain waves. So you might say heart rate feedback or muscle tension feedback. And then when we talk about brainwave feedback, it's gotten the name neurofeedback, but it could be called EEG feedback or brainwave feedback.
And you can see it on a screen. You can
Yeah.
actually see your brainwave activity in like there's I think programs like video games. So like if you're more relaxed, the hot air balloon rises, for example. That kind of it. And then the same for neurofeedback. You're trying to get someone to be able to focus or improve their memory or whatever it might be using these
Yeah.
devices.
Yeah.
It's pretty
So
cool.
do you give them specific things to do in order to change?
Yes and no. Yes and no. Okay. With the peripheral types of biofeedback, and by peripheral I mean things kind of like below the neck, okay? It's more, you have to be kind of cognitively involved in learning how to breathe diaphragmatically at a particular pace and style that helps to relax your body. So you have to kind of think about it and focus on it. With brainwave feedback, you simply need to give the brain the information. And we're finding that sometimes audio feedback, visual is good, but audio is maybe even better because you can pick it up faster. And so that's not so much structured in telling people what to do, it's just letting them get the information. For example, it's a little more like if you learn to ride a bike as a little kid, you're not consciously saying, okay, now I need to do this and that and the other thing to ride the bike. You're kind of getting that information coming to you, and your brain begins to regulate your balance and speed and that sort of thing. So it's more that subconscious part of your mind is sorting it out versus the cognitive part that has to decide and make decisions.
That's a great description. Dr. Bertoni had a...
Yeah, this is not quite biofeedback or neurobiofeedback, which is much more precise because it deals with training your brain waves, as contrasted with general biofeedback, which is more autonomic nervous system. But when I was a kid, because I have ADD, and when I was a kid, I noticed that there was a problem going on with my paying attention. And I learned that by taking notes, by writing something, it would force me to pay attention. And so I developed this reputation of being kind of obsessive compulsive, and I was not. I was basically ADD, and I was compensating for it, and I still do that today. And so it's these little things, and I'm lucky that I did that because back in those days, they called ADD minimal brain dysfunction, MBD. So I didn't want to be labeled with that.
Oh, I was just going to make one more thing. There's the autonomic nervous system that's involved in feedback. But a lot of what I've done in the past is skeletal muscle feedback for chronic pain
Mhm.
and rehab. So there's a bunch of systems that we can.
Right, so
Yeah.
you have that too, and you have the temperature
Yeah.
and a whole bunch of other
Yeah,
things.
so there's the autonomic and
Right.
skeletal muscle.
I love it. Good discussion. So on that note, the brain is plastic. The concept of neuroplasticity, that we actually can change your brains. We used to think that you were born with all the neurons you're ever going to have, and you just kind of lose them until the end. And we can actually change our brains. We can improve our brains over time. And we can enhance areas we want to enhance, and we'll lose areas we don't enhance. And I really believe that as we age, it's not a set thing that we're going to decline in cognition. I don't think that has to happen, because if you think about it, we typically do less as we age. We retire, and we don't activate our brains as much, typically. I know none of you do that. I know that you're all activating your brains still. And I think if we can continue to give our brains something to work on and work with in all different areas, sort of cross-train our brains, not just do crossword puzzles, but do exercise, do some brain games, learn a new instrument, a new language. Up until the end, I think there's no reason we can't have good cognition, focus, memory throughout our whole entire lives, and we're living longer than we used to live. I just encourage you all to take that to heart, the concept of neuroplasticity. And you know what, this is true for ADD as well. Folks who start on medication are able to, through like what Dr. Buttoni was talking about, you can really learn to plan ahead, learn to organize as ways to compensate and strategize. And I think folks do get better at those different skills too, and needing less medication over time. And I think that's a really cool concept. Neuroplasticity, again, the Olympics, I mean, these Olympians are experts at it. I mean, they're exercising first, which actually increases brain-derived neurotrophic factor, fancy word, for basically miracle growth for the neurons, which helps increase connections, increase growth. So exercise, again, is perfect things for learning. You exercise and then you learn something. It's ideal. Let me give you a little anecdote. There's a school in Chicago, Naperville, and they did an experiment where instead of taking physical education out of schools, which is what's being done, they actually put more in. So for an hour every morning, these kids were made to exercise, and at the end of the year, they were second. They did testing, standardized testing. At the end of the school year, they were second in the world in math and science, and number one was Singapore. And this is a school in Naperville, and these kids were, the sons and daughters of biotech. This was an area of affluence in biotech. So they were genetically stacked in that direction. However, in this area, Redmond and Bellevue and stuff, we aren't scoring number 2 in the world in math and science. So, we have a lot of biotech and smart people too. So, I think it says a lot about the effect of exercise and cognition. They really are linked. This is Jean-Luc Picard playing some brain games. Now let's talk about different ways to enhance further in natural ways. So we talk about supplements. Have any of you seen the movie Limitless? No? Well, this is the guy from Limitless, and basically the tenet of the movie is he finds a smart drug that helps him use 100% of his brain, and he becomes brilliant just basically by taking this pill. And he's able to do all these amazing things, have success in his life. It's a very good and interesting movie, and I feel like some of these supplements are kind of like that. They're not quite to that degree, but things like phosphatidylserine actually help because 10% of your brain is made of this stuff, phosphatidylserine. It's a mouthful, let's call it PS. And phosphatidylserine actually helps increase connections. It helps increase this brain-derived neurotrophic factor, this stuff that increases neuronal connections. It's been studied to help in memory for older adults as well as younger adults. So it's been most studied in Alzheimer's, but it's also been studied in college students who are trying to remember and study for tests. And it actually can improve that. I wish I would have known about it when I was going to naturopathic medical school and undergrad. And it really does help. I've taken it myself. I feel like it really helps me feel sharper and focused, and a lot of patients do as well. It also has been studied in ADD specifically. And so this nutrient is interesting. It's not stimulating, but it helps with connections. So it's working by a different mechanism than we normally think about. With ADD, we're trying to improve and increase energy to the frontal lobe. And the whole problem with ADD is the brain becomes sleepy and fatigued over time. And what these adrenal herbs do, they're called adrenal and adaptogenic herbs because they help us adapt to stress. They improve our mental and physical endurance and performance. And so in that way, they increase our ability to concentrate for longer periods of time and also adapt to physical stressors, which we're under. And so basically, they help the brain stay active for a longer period of time versus being like a stimulant that you feel, like caffeine, you feel awake and alert. But these basically help you sustain your level of alertness over time so you don't get sleepy and lowered mental acuity in the afternoon or later in the day. A third one I want to tell you guys about is called tyrosine. So that's a more specific and focused nutrient. It's an amino acid, and it improves the body's ability to make dopamine. So dopamine is a neurotransmitter that's stimulating. All the ADD meds kind of work on dopamine. That's sort of the theory. It's very stimulating to the frontal lobe. So tyrosine helps your body make more dopamine so you can concentrate and focus. And it's an over-the-counter supplement.
What was that name again, please?
Tyrosine, Tyrosine. So these are 3 very effective supplements that I found to help people. I'll share an example for you, with you. There was a student who did fine in high school. They tended to procrastinate, but they did fine on tests because they're very smart. And they got to college and started failing out of classes. Has anyone heard of stories like this where kids do fine in high school, but then they don't do well in college? What's the difference between high school and college?
You learn faster, you have to learn more things faster.
You have to learn more things faster. Anything else?
You're responsible for planning your study.
Exactly, there's no parents. What are you going to say?
Structure.
Structure, exactly. Our brains aren't fully developed until we're 25, especially the frontal lobe, which is what we've been talking about. And a lot of kids, I think, and Dr. Amen, I think, says that kids shouldn't leave the nest until they're 25 because of this. We should kind of watch out for them. And that's because, especially for this person I'm talking about, their parents were their frontal lobes in many respects. Like, you need to study, come on, let's do this. But then in college, there's no mom or dad saying you need to study, you need to get your grocery shopping plan ahead. And that's prefrontal cortex function. So this individual had ADD. We could see the signs much younger as a kid, because you have to have them to have the classic ADD. And they needed support. They needed prefrontal lobe support to concentrate. And they also needed help with organization and planning skills too. But with intervention, they were then able to, they had to actually withdraw, and then they could go back and do very well. He did very well in school after that because he had frontal lobe support. That was really a key. So I thank you all for your attention today. That's it, yeah.